Hello, thank you for joining us today. My name is Judy Ganem. We're with Compassionate South Carolina, a grassroots patient advocacy organization forged to help patients throughout the state of South Carolina. And I'm joined by our executive director, Janelle Ralph, and Don Howell, who is not only a veteran and a Purple Heart recipient, but he is also a registered nurse, and he has a lot of experience working with veterans. Thank you for joining us, Don.
Thank you. So we're here again in Columbia. We spent a lot of time down here and next to the State House, and we are going to be doing a series of these. What we're doing is we're highlighting advocates throughout the state that are working on the Compassionate Care Act, which is the current piece of legislation we're concentrating all of our efforts on to allow patients throughout the state alternative treatments through medical cannabis. So we're here with Don today, and he is one of the advocates that has been working with us and our organization now for
about a year now.
So pretty much several State House trips.
Yeah.
So Don, why don't you go ahead and tell us a little bit about yourself and how you got into this?
I am a veteran. I was in Beirut, Lebanon back in 1983 during the bomb blast. And I'm also a registered nurse. Kind of got into this space through belief. Quite some time ago, I've always kind of studied cannabis and how it was used in other countries for medicinal uses. And just fast forward, I had a relative of mine who passed away from cancer. One particular day, she had received chemotherapy, and she had hyperemesis, and she just couldn't, stop it. And she was offered a product, a cannabis product, and with a very, very low dose, it quieted her stomach, and she was able to eat like two plates of food. And this was in a really short period of time. I think she probably used the cannabis product, and within about 10 minutes later, she was able to eat. So, my experiences, and then I also went to Amsterdam, and I was able to talk to a lot of the dispensary owners and a couple of people who was working with the medicinal side of it. So I was able to get a good broad perspective of how well it could be used, and then being a nurse, I was able to see ways it could be applied to my patients.
Nice. So what do you say to, being that you are a nurse and being that you are an RN and you some of the things that you've seen in your practice, what do you say to the opposition when they say that it needs to be FDA approved? And just so we kind of talk on this subject a little bit, the federal government has cannabis as a Scheduled I drug. It's higher scheduled than methamphetamines and obviously opiates. A Scheduled I drug is the highest of scheduling, and basically what the federal government is saying that medical cannabis has no medicinal value, and that's what they're saying when they schedule it, and which leaves us in a very precarious situation because the government cannot actually do a lot of research on it. There is research going on though, and a lot of people say we need more research. Well, currently throughout the country there's we'll just take an example. The American Academy of Science actually looked at the latter part of last year, they looked at 10,000 reputable research studies done on medical cannabis. And what their findings were, and now this is the American Academy of Science, came out with a statement that cannabis has medicinal value. It has medicinal value for chemotherapy, for cancer patients. It has a true medicinal value for pain patients, and it also has medicinal value for muscle spasms, and we now know epilepsy is in that realm. So being that has now come out with all of these studies that they looked at over all of these years, and yet the federal government still won't remove it from Schedule I. What do you say, and even if it was removed from Schedule I, the process would be tedious. It would be years and years before we could get actual access to medicine through the federal government, which is why these states have set up programs to access it now. 29 states today to have comprehensive medical programs. What do you say to the opposition when they say it needs to be FDA approved?
Well, as you were saying, that it's a process once you move it from Schedule I to Schedule II. At present, a lot of states have adopted utilization of it, and of course there's a federal government pushback. in the earlier stages, I think it's a healthy thing for each state to go ahead and utilize it in a medicinal way, more or less like a pilot program, just to verify the medicinal uses that have been demonized for many years. And then moving forward, as there is a better understanding, like there is most pharmaceuticals, because it's basically, it's a testing process in regards to how it affects people, and unfortunately we don't have a lot of research that would support that. But moving forward, it would give the public a good opportunity to see just how useful it is. And then as time moves on, moving it from Schedule 1 to Schedule 2 would be a very good thing, although there's a few people that tend to oppose that. But in order for it to be accepted, I think that it should be moved to a Schedule 2 in some respects, just so that it can be more accessible and allow more access or availabilities, options, I should say, to other patients. And then last, of course, to remove the legal stigma from it that tends to follow the utilization of cannabis.
Can I ask you, Don, from your experience working with pharmaceuticals and how pharmaceuticals are regulated, how would you respond if someone claims that once the medical cannabis bill gets passed, that there will be diversion into the hands of people that don't actually need the medical cannabis?
And that can be applied to any pharmaceutical medication out there right now. There's always diversion, and as you know, there's an opioid crisis out there, and that's all diversion. You really have to be vigilant in regards to caring for it. I think that one of the main issues is that they don't want children under the age of 18 to utilize it and possibly have adverse effects in regards to their use. But bottom line is that I think that it's important that we get that people understand that the utilization of cannabis is not as we have been taught, as it being demonized and it being a terrible thing to use and so forth. It does actually have medicinal purposes, and there's over 20 states in the United States that has legalized it, and the proof is in the pudding right there.
Yeah, so there's 29 states that currently have a comprehensive medical marijuana program, and when we talk about these programs, some of the most recent ones coming online, like Pennsylvania, Ohio, and I always refer to the Chicago, or the Illinois, I'm sorry, not Chicago, but the Illinois program, because it is so tightly regulated, which is really similar to what we're pushing for in South Carolina. It's very similar to the Illinois bill, where we're going to have, oversight by not only DHEC, but law enforcement into these facilities. They're going to be set up like Fort Knox. They're going to have clear, everything is tracked, just like the opiates are tracked from a pharmaceutical model down to the dispensary. You have to fall under a conditions list in order to get a card from the state to treat with it, and you are only allowed to have a certain amount over a certain period of time. It's very much like the pharmaceutical model, probably actually more restrictive than the pharmaceutical model due to the stigma around the plant and having law enforcement involved with it as well. One of the questions I have, I'm glad you brought up teen use, because this is another issue that we're facing with the opposition, saying that these bills will increase the teen use of cannabis. However, in states that have passed comprehensive medical marijuana bill, there is zero research studies that show that the teen use has actually increased. Actually, there's the opposite has happened.
Right.
So what do you say, about that?
Okay, two things, and maybe referring back to Judy's question again. First of all, when you want to restrict any medication from children or teenagers and so forth, there's a lot of ways of doing that. One thing that you have to do is, of course, having a lockbox. Another thing that is mentioned, particularly in my practice, is that we have what they call pill count. A patient is given so many medications for a particular period of time, and when a patient comes in for an appointment, you can ask him to bring his medications in, and we can count those pills to see if in fact he's diverting it, if in fact he's using it in the fashion that was prescribed. So now when it comes to teenagers and so forth, yes, there isn't much evidence out there regarding teenage use, but in time, there can be uses. I think one of the main things is that psychoactive effect, and the psychoactive effect can be minimized, if not extinguished, depending upon how how the cannabis product is processed.
Absolutely.
You know, so there is room for cannabis use amongst children, but then again, there has to be more studies to be provided, which will create. We need, of course, federal funding for that.
So can you tell us a little bit, for people out there that have never actually gone to a legal state or other areas where they have comprehensive medical programs, can you tell people how this stuff is actually delivered? Because I know people are thinking in their mind, oh, it's just a bunch of people with bongs smoking it, and that's not medicine. So can you explain when you go into a dispensary, what you can buy in a dispensary? Okay,
that's important. First I want you to understand is that cannabis is a medication. And the cannabis can be delivered in a pill form. It can also be delivered in inhalation form. It can be put on topically. And these are all the same routes that any other medication can be given. And again, I reiterate that cannabis is a medication, so therefore it has the ability to be delivered in as many routes as any other pharmaceutical. So, and that would be more specific for the need of the patient. Case in point, sometimes you may have back pain, you might have a topical, and we also can give you an oral at the same time. So.
Yeah. So I know some of the dispensaries that I have the pleasure to visit. I know that they have inhalers, they have gel caps, they have patches. They've got obviously different vaporizer methods. So it's no longer just smoking it. And no, we don't inject cannabis. I know that there was some people that had a misconception that people are actually taking needles and injecting it in them. We don't do that. That's not a delivery method used in the cannabis world. So as of yet, I mean, maybe after it was rescheduled, it may be something down the road that pharmaceutical companies would come out with when they're able to produce cannabis products. So.
Don, if I may ask you a more personal question, because of your experience in the military and your work with veterans, can you give us an idea how the PTSD is affected by cannabis versus what's currently available from the VA?
Okay, so PTSD specifically, just a mild overview. PTSD affects a person. First of all, a person has to be basically exposed to a violent event. Oftentimes a car accident or maybe even just the rigors of war. And it actually changes the biochemical chemics in your brain, where you're not able to process stress anymore. You have what they call fight, flight, or fight or flight, I should say. And what happens is a veteran has a problem interpreting it. Say, case in point, if he hears a loud noise, like there's construction going on in a city, a lot of people may not respond to that, but he may respond to it in a hyperactive way because he can't process that information that's coming in, and then you run into mood issues. They can't necessarily control their moods. Sometimes they tend to be, quick-tempered and or sometimes absolutely apathetic to someone who's probably in need. So what it does is the cannabis will help modulate all of those symptoms, because unfortunately veterans who have all those symptoms, and there are a myriad of them, and it's piled on top, it tends to lead to bigger things like homelessness, isolation, and of course suicide. So the cannabis is able to modulate and reduce all of those symptoms so that they can be a little more productive in society.
And the current pharmaceuticals on the market for PTSD victims,
right?
Are they actually helping, or are they hurting this? Or is there anything?
Yes, one of the medications that he uses, like say for instance Prozac, and there's other medications, and the side effects of these things are long lasting, and it takes about 30 days for these medications to even work. So you really have that veteran. Let's say for instance, if he's calling out for help, it's clear that he's going to harm himself or someone else, and you give him a medication to help, a psychiatric medication to help with all that medication, with that type of behavior and thought process, it takes 30 days for that pill to kick in. So they're still at risk for those 30 days, and during that time frame, they could hurt themselves or someone else. So between the side effects and then just how long it takes for the medication to kick in, a lot of veterans choose not to use it at all. And then of course there's some psychoactive therapy or psychotherapy that they were asked, where they are asked, the veterans are asked to relive that traumatic event, which is very difficult.
Yeah.
And of course they choose not to do that either.
Of course.
So the cannabis can be very useful in that regard.
Well, is there anything, I know you've been at this for a while, you've gone to the State House with us several times, you've done educational events with us. Is there anything that you would like to say to anybody watching about this issue and just, put your stamp on it?
Right. As a nurse, I've spoken to a lot of my patients in regards to the side effects that they tend to have with the medications that they take. And oftentimes those side effects are really the main things that causes people not to use medication that could be helpful to them, not to use them at all. And then a lot of times doctors are very limited in what they can possibly give. So it's important that legislators understand that doctors as well as patients, because they do have a part to play in their medication or in their illness, they need options. They need more options other than what's prescribed and then having adverse reactions or side effects that they care not to have. As a veteran, I think it's important for the legislators to know that we have 21 suicides a day with our veterans, and with what they're faced with, the cognitive issues and the medications that's prescribed, it's not conducive for quality of life for them, and they choose not. And as a result, suicide rates continue on. So we need something that that's more faster acting, and it's just to give these veterans an opportunity to live productive lives, because they put their lives on the line for the freedom of all of us, and unfortunately when they come back there's just no reprieve from the psychological issues that they tend to endure. So yeah, so vote yes and support the cannabis movement, because indeed it is indeed a movement.
Well, thank you so much for joining us today.
Thanks for having me.
Do you want to say absolutely? Thank you, Don.
Absolutely.
Thanks, Don, and thanks for all your hard work,
All
for
right,
sure.
thank you.
And we'll see you guys next time.
All right.